Hawaii Music 93.5 FM. Here we are on the 4th of July. Hope you're enjoying your day off. Well, our friends from Maui Health want to make sure that you get the information that you need, all of what we need to tell you. And we want to say good morning to Jessica Acop. Good morning, Jessica.
Good morning. Happy 4th of July to you, Shane.
Happy 4th of July to you, Jessica. You know, the battle never stops, you know. When it comes to health and our health and wellness, well, you guys have always been there to make sure that we get that information across. So, Jessica, thank you for joining us this morning. Jessica, when should someone seek professional medical help for a wound instead of treating it at home?
Oh, that's a great question, Shane.
Yeah.
I have a couple of key points in mind.
Okay.
Excessive bleeding, you know, if the wound is bleeding heavily and doesn't stop after applying pressure, about 10 to 15 minutes, it's time to see a doctor. Deep wounds, so if the wound is rather deep or large, hopefully not a lot of us are using fireworks today, but if you develop a wound and it's deep, it's time to seek medical help. If there are signs of infection, be on the lookout for increased redness, any swelling, any fever. These are signs of infection and requires a physician's attention. Worsening wounds, like wounds that don't show any healing after a few days or appear to be getting worse, for sure we need to check that out. Foreign objects, so let's just say your wound got embedded with a piece of wood or glass that you can't easily remove. Actually, I would advise from removing those foreign objects yourself, so you have to seek medical help for that. Animal or human bites, hopefully no animal bites this 4th of July. I mean, no human bites also this 4th of July. But wounds caused by animal or human bites are at a higher risk of infection. So you have to come to the emergency room for these types of injuries or wounds, or actually go to an urgent care. Any wounds that are at risk for tetanus, if you don't have your tetanus vaccine up to date and you were punctured by, let's just say, a rusty object, or your wound was let's just say exposed to dirt, this can be a tetanus risk, and for sure you need to come to the ER or seek medical help. Any underlying conditions, honestly, patients with diabetes or compromised immune system, seek professional advice if you have a wound. In most cases, your primary care physician can help you, but we have quite a few urgent care providers here in the island that can also help you. But for sure, for emergency care, don't hesitate to visit us at the emergency room at Maui Memorial Medical Center. And lastly, if you have a wound that just won't heal, these are wounds that are 30 days old or wounds that keep closing and opening up, we do have a new wound care center at Maui Memorial, and we can help you with our advanced dressings and advanced techniques and technologies, just like our hyperbaric oxygen chamber. And most importantly, whenever you have any doubt, it's best to consult a healthcare provider. We do have a wound care quiz on our website. It's at mauihealth.org/wound care quiz to see if you're a wound care whiz. So you can always take that quiz to ensure that if you need any medical help or not. So take that quiz, or you can just give us a call at 808-986-4500 at the Wound Care Clinic.
Awesome. Jessica, that was some awesome information. You know, sometimes we like to take care of ourselves. Oh, no, I'm okay. I don't have to go to the hospital. Well, you just gave us some very crucial points and places where we reach that we need to get to the hospital. So thank you for that, Jessica. Jessica Acop, Program Director, Hyperbaric Therapy. Jessica, have a wonderful 4th of July. We'll talk again, okay?
Thank you so much, Shane.
Aloha, Jessica.
Aloha.